Okay. Here on Boy Dynamic, what's your name?
Danny Phantom.
Danny Phantom? Okay. All right. So on Danny Phantom, know your lefts and your rights. Okay. It's got to be to the patient. Okay. Here's the right side, here's the left side. A lot of times when you're looking at it on the exam, you're going to say, this is the left and this is the right because you're looking at it, but don't do that because you're going to be wrong. Okay. Left and right is one of the most common things that people flip-flop on the exam here. Okay. When you're looking at this and trying to get the structures of inside the heart, always, for me, I always did it in terms of how blood is flowing through this sucker. Okay. Even for the arteries and veins. Okay. Start with how the oxygenated blood gets out, and then follow it all the way back. How it goes up to the head, how it comes back, how it goes down the torso and down the leg, comes back up the leg and back up the torso. Okay. Just look at it like that, and it makes it very easy. It's just a sequence of events. All right. So here, I have all the deoxygenated blood from the upper, the lower, and the heart itself all returns to this upper chamber right here. This is the right atrium. It goes through A, and it's the white structure right there. Okay. This goes through the right atrioventricular valve. It's also called the tricuspid valve because it has 3 cusps. Which one can you use? Either one, don't matter. So we go through the tricuspid valve, and now we're inside the right ventricle. To leave the right ventricle, we have to go through another valve. It's that white dude right there again. Okay. This is the pulmonary trunk, or I'm sorry, this is the pulmonary valve or the pulmonary semilunar valve. I would take either one. Okay. Some textbooks call it one way, some call it the other way. So I'll take either one. This deoxygenated blood now enters into the pulmonary trunk. Okay. And now we enter the left and right. Okay. Left and right pulmonary artery. It's blue, so that usually means it's deoxygenated. Okay. And that would be the case here. But it's an artery, right? When we think of arteries, we think of oxygenated blood. Arteries and veins only mean we carry away from the heart, an artery, or we carry toward the heart, a vein. Okay? It doesn't say anything about whether it's oxygenated or deoxygenated. When we think of the systemic system here, yeah, blue guys are the veins. Always going to carry deoxygenated blood back towards. The ones leading the way are all red, carrying oxygenated blood. But here in the pulmonary trunk, or in the pulmonary system, okay, it's backwards. So here, these are pulmonary arteries going away from the heart towards the lungs, drop off the CO2, pick up the oxygen, and come back oxygenated. And these pulmonary veins, left and right, pulmonary veins, left and right, pulmonary veins. So now we've got oxygen. So these oxygenated red blood cells all enter here. This is the left atrium. Okay, the left atrium. Go through another valve right there. This is the left atrioventricular valve, or the bicuspid. You try it before you buy it. Well, you used to. Now you don't do that anymore. Okay. So we enter into the left ventricle down here, the lower chamber. And then there's that white dude right there at the end of my pointer. Okay. That is the aortic semilunar valve, or the aortic valve. Okay. We'll go through that valve, and now we're in the aorta. We have the ascending aorta, the arch of the aorta, and this little portion here, the descending aorta, and then they transition it to call it the thoracic aorta. So those are kind of the structures that blood is physically going through or passing through. Okay, we have a couple more things right here. Again, here's my valve, and all these are the cusp. Okay, I'll open up both these. Here's the valve. Okay, and those valves are made of those cusp. The tricuspid valve, 3 cusp. 3 areas of 3. 1, 2, 3. 1, 2, 3. And this side is the bicuspid. It has 2 areas of cords. Okay. Same thing on this side. It just has 2 areas of cords. There's 1. There's 2. Okay. 1 and 2. These are the chordae tendineae. They are the strings that attach to the cusp. Okay. The strings that attach to the cusp. When this heart contracts, when these ventricles contract, because these are the ones that generate all the force, that causes these cusps to close. These cords, okay, pull down and prevent those flaps, those cusps, from being blown backwards. Right? How do those chordae tendineae, how do those cords prevent that? They attach themselves into that papillary muscle. Okay? Papillary muscle. Papillary muscle. Papillary muscle. Okay. Papillary muscle contracts, pulls down on those cords. The cords pull on the cusp and they hold and prevent those flaps from being blown backwards. Okay. So those are chambers, structures, components that allow this blood to move forward through this structure. Boom, 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 boom. Then if we look at the blood vessels around it, you'll see there's a ton of them here. Okay? All of them do have names. We're just looking at the big ones. Okay? The first 2 big daddies are the one right here and right here. Okay, that little nub. It's actually just like this one. It's really pronounced. It's just it travels underneath the pulmonary trunk, so we don't see it on the models. Okay. This one goes to the right and supplies the heart. This one comes out and goes towards the left and supplies the heart. Right coronary artery, left coronary artery. If I just stay on the front here, okay, left coronary artery gives rise to some branches. The only one I want you to know is this one right here. That red dude in the front. Okay? The red dude in the front. This is the the anterior interventricular artery. It's in the front, it's between the 2 ventricles, anterior interventricular artery. Follow the right coronary all the way around. Follow it around. It gives rise to a number of them. The only one I want you to know is right here on the back, between the 2 ventricles. It's the posterior interventricular artery. Okay? Posterior interventricular artery. Arteries takes the blood, oxygen, all that nonsense to all the cells here, and we bring all the deoxygenated blood back towards the heart. And the one on the front is the great cardiac vein. It's great to be on the front. On the back side is the middle cardiac vein. The middle child gets pushed to the back. All of these veins, and even the ones that we didn't name, all of them, as you can kind of see, this one gets dumped right here, and you can see it starts to travel around, okay? And it enters into this enlarged venous structure right here. And that is the coronary sinus. Coronary sinus, the inferior vena cava, and the superior vena cava. Dump into the right atrium, and we start it all over again. I did not say here. Superior vena cava. Here, these are 2 different blood vessels. Okay, this is left and right brachiocephalic veins. They dump into the superior vena cava. Okay. So right there is the superior vena cava. If we look on this model here, right here, here is my superior vena cava. Right there. And hell, anywhere below the heart is the inferior vena cava on this model. Okay? It's right here on the back side as well. Okay? But it's the big hog that's moving through the center of the body there, right there. One other thing I want to show you real quick. Perfect. Okay. We also have 3 major vessels that come off the arch of the aorta. Okay. This right here is the brachiocephalic trunk or brachiocephalic artery. This one comes off and goes in this direction. Okay. Just right here. Brachiocephalic trunk. This one comes off and goes up right there. This is your left common carotid artery. This one right here comes off and goes, boom, in this direction. Comes off and goes out. This is your left subclavian artery. Are there a right and a left of these two? Yeah. They just don't come off the arch of the aorta. Show us right here. Again, here's my ascending, here's my arch. Okay. If we look right there, okay, right inside right there, okay, that's where my brachiocephalic trunk is. Okay, my brachiocephalic trunk right there. Okay. Brachiocephalic trunk. The first major branch, you see it right there. Okay. Here's my left common carotid right there. My left common carotid. And I'll just show you from the back, there's my left subclavian artery. There's left subclavian artery right there. I have those on the right side. Okay. There's my right common carotid right there, the red dude. Okay. Right common carotid, the red guy. Right common carotid, the red guy right there. And then there's my right subclavian artery. Okay. See it easily from the back, right subclavian. See it easily from the back, right subclavian. 9 times out of 10, if you know the artery, you know the vein. Okay, there's only, in the leg, there's only 2. In the arm, there's only 2 that there's not a corresponding artery for. So basically it's, if you know one, you know the other. They're always paired. See it on the right, you see it on the left. The only spot where you only see singles is right here in the center around the heart. And we're not even going to go over those. So those are the structures of the heart and the major blood vessels that we see around the heart itself. We'll go over all the blood vessels next week. Okay. Unless you want to go over next.